If a doctor suspects lung problems or wants to monitor how effective a treatment is, he may order testing called lung function tests or pulmonary function tests. Pulmonary function tests are ways to measure how well a person's lungs are working. There are several types of pulmonary tests such as spirometry, lung plethysmography, 6-minute walk test, and cardiopulmonary exercise test. A single type of lung function test cannot determine all the lung function values, so more than one type of lung function test may be needed. In addition, some of the tests may be repeated after inhaling a bronchodilator. A bronchodilator is a medicine which will open up the airways. A doctor can then compare the test results with and without medication. A physician may order lung function tests to determine how well a person's lungs are working. If a person has chronic lung disease or a condition which affects the lungs, a doctor may use pulmonary function tests to monitor the condition and treatment plan. Pulmonary function tests can help a doctor diagnose respiratory issues such as asthma, allergies, chronic bronchitis, respiratory infections, lung fibrosis, chronic obstructive pulmonary disease, bronchiectasis, and others. For most people, the procedure is done on an outpatient basis, meaning the person arrives, does the testing, and goes home all on the same day. The two most common pulmonary function tests are spirometry and plethysmography. During spirometry, a person breathes into a tube attached to a machine called a spirometer. Spirometry measures a person's airflow. These measurements include how much air is breathed in, exhaled, and how quickly this can be done. Forced vital capacity, abbreviated as FVC, and forced expiratory volume in 1 second, which is abbreviated as FEV1, are two important measurements gained from spirometry. Forced vital capacity is the total amount of air a person can breathe out after taking the deepest breath possible. Forced expiratory volume in 1 second is the amount of air a person can forcefully exhale during the first second of the forced vital capacity test. During plethysmography testing, a person sits in an enclosed, clear box. A person then wears a nose clip and breathes into a mouthpiece attached to a machine which takes measurements. One thing plethysmography measures is how much air is in a person's lungs after taking a deep breath. This is called total lung capacity. It also measures how much air remains in a person's lungs after exhaling as much as possible. This is called residual volume. Typically, people are advised not to eat a heavy meal before the test, smoke, or perform intense exercise for 6 hours before the test. In addition, people are asked to wear loose-fitting clothing. For more details, please consult with a medical provider. There are many lab values gained from having pulmonary function tests. It is important for a person to discuss the results with his doctor. To understand the test, here's a list of abbreviations which may appear on test results. Forced vital capacity. This is the total amount of air a person can exhale after taking the deepest breath in that he can. Forced expiratory volume in 1 second. This is the amount of air a person can forcefully exhale during the first second of the forced vital capacity test. Total lung capacity. This is the total amount of air in the lungs after a person takes a deep breath. Forced expiratory volume. This is the amount of air forcefully exhaled during the first, second, and third seconds of the forced vital capacity test. Peak expiratory flow rate. This measures how fast a person can exhale. Forced expiratory flow. This is the flow or volume in the middle of an exhalation. Forced residual capacity. This is the amount of air which remains in the lungs after a person breathes normally. Maximum voluntary ventilation. This is the amount of air a person can inhale and exhale in 1 minute. Minute volume. This is the amount of air exhaled per minute. Vital capacity. This is the total volume of air a person can breathe out after inhaling as much as he can. Total volume. This is the amount of air inhaled or exhaled during normal breathing. There are 2 other tests which a doctor may order to assess a person's lung function while exercising. They are the 6-minute walk test and the cardiopulmonary exercise test. The 6-minute walk test measures the distance a person can walk on a hard, flat surface in 6 minutes. Doctors use this test to understand a person's ability to perform daily physical activities. During the cardiopulmonary exercise test, a person walks on a treadmill or rides a stationary bike while the heart and lungs are monitored. After the data has been collected, a physician will review the results with the patient. The doctor will discuss if a disease is present or may talk about if a medical condition has changed. If needed, a treatment plan will be developed which may include medication, inhalers, pulmonary rehabilitation, oxygen therapy, and lifestyle changes. Over time, lung function tests may be repeated to monitor a person's lung function and lung health. If a person has a neuromuscular disease or if a neuromuscular disease is suspected, please ask for the spirometry test to be performed both in the sitting and lying down positions. A person with a neuromuscular disease can have a decrease in lung function by as much as 50% when lying down. Most providers only request the test to be performed in the sitting position. Serious lung issues could be missed for people with neuromuscular disease if the test is not also done while the person lies down. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye!